So let's start with some terminology. This will help you understand as we go through the anatomy and orient yourself when we talk about different muscles. So a few common terms that are used just to begin with. The first one is medial and lateral. And when we talk about medial and lateral, what we're talking about is in reference to the midline of the body. So anything that's going to be medial is going to be closer to the center line or the midline of the body, and anything that's lateral will be further away from that. So if you were to draw a line straight through the center, my sternum is going to be medial to my shoulders, and the sides of my waist will be lateral to my belly button. And so again, one simple way to kind of orient as we talk through this. The next one that's a little bit more familiar is going to be simply anterior and posterior, and this is referring to the front and the back of the body. And generally speaking, these are in reference to anatomical positions. So the anterior part of the body is going to be the front side. My face is going to be anterior to the back of my head. My spine is going to be posterior to my belly button. The next one is superior and inferior. Again, another one that's a little bit more familiar to you probably. Superior is just going to mean above. Inferior is going to be below. This gets a little tricky when we start to turn upside down, but again, generally speaking, we're talking about this in relation to anatomic position. So my head will be superior to my pelvis, and my pelvis will be inferior to my head. The last one is a little bit less familiar probably. This one is going to refer to the limbs of the body here, and it's in reference to what we call the axial skeleton. The axial skeleton is going to be the skull and the spine and the central part of the body. So when we talk about the limbs, this is really helpful, especially in yoga, as we start to move and articulate in different setups. As the limbs start to move around quite a bit, it does help us to articulate in reference to the proximity of the limb to what we call the axial skeleton. So proximal is going to talk about anything that's closer to the axial skeleton versus distal, meaning distant or further away from the axial skeleton. So my fingers will always be distal to my elbow, and my shoulder will always be proximal to my elbow. Whether I'm in headstand or triangle pose or warrior pose, that will always be the same. So it's a helpful term to allow us to talk about these things as we move around and orient ourselves and reorient ourselves in space.